All right. So thank you, everyone. So welcome to this education night from the Alberta Lymphedema Association. Um, we are a patient-centered and volunteer-run organization, charity that's focuses based on awareness and access to treatment. And education comes part and parcel to both these things. So for general awareness, obviously letting everyone know about lymphedema, as well as the oops, sorry, letting people in, as well as the access to treatment aspect, because we want to increase education opportunities and awareness for healthcare professionals and other allied health professionals who can assist in the access to treatment aspect. So these educational nights are really important to us, and they're free for all to attend. And we thank you so much for being here. It is World Lymphedema Month, which is an opportunity to learn and reflect and share. So I'm very excited to welcome our presenter tonight, Robin Devine, who is actually the vice president of our association, but she is also a certified lymphedema therapist, or a CLT, of many years. She's owned several clinics, led teams of CLTs, and been involved in a lot of advocacy for lymphedema patients in Alberta. And the more recent example of that is the LymphyCon Health Conference, which she started single-handedly. It's an amazing event, which I hope Robin will touch on briefly at the end of the presentation. But she's done a lot of great work there. And then also recently, she's been an instructor for the Chikly Health Institute, and she actually helped get Chikly LANA-certified. And LANA is the Lymphedema Association of North America, which is basically our gold standard of lymphedema care at the moment. And there's Robin will talk about it, but there is just a lot of talk about lymphedema nowadays, and there's certificates from pop-up schools, and there's different treatment modalities being pushed around that aren't backed by research or medical experts. So it's really important that we are going to people who are properly trained, or that people who have some training, that they have their limits and pass things on to other people and that kind of thing. It's just, you know, it's a very serious treatment because lymphedema is a lifelong ailment. So that is why this talk is so important. And with that, I'm going to stop talking and pass it off to you, Robin.
Thank you, Allison. Yeah, no, I absolutely love, obviously, I've done several different talks for the association. Um, and I have like this, I do love talking about lymph. It is probably my favorite topic next to, travel or painting and my kids. But um, so yeah, I've been a massage therapist now for way too long, but around 25 years. And I've been a lymphatic therapist for 20, and I've been a lymphedema therapist for 10 of those. So there is a very distinct difference between a massage therapist, a lymphatic therapist, and a lymphedema therapist. And so this is a very common question that we get all the time. And, well, I'm a massage therapist. I took lymph training, so why can't I treat lymphedema? Well, dude, we can really go into this and we will. So I absolutely love helping clarify, and I do feel very lucky that I have these different branches of expertise, having also taught massage therapy in three different massage school programs here in Calgary. Um, I've worked with the Chikly Health Institute now I started my training with them 20 years ago, but I've been a teacher with them now for almost 10 years. There is some very big differences. And if you're not inside the massage world or the lymphatic world, you might not know these things. So this is why I wanted to create this presentation and talk about it, because not all therapists are created equal in their scope of practice. And that's really important to understand the differences. So there's a couple things. So the first thing we're going to talk about is all the fun stuff we're going to cover. So the first thing we're going to talk about is we're going to talk about the foundations of lymphatic drainage. We're going to talk about the different types of trainings that are available, the scope of practice for each level of training, because, like I said, the amount of training allows you to access and work with different populations, which is really important. And then last, how do you find the right therapist? So, the first thing I want to sort of clarify is that the foundations of lymphatic drainage is not new. Okay. When people send me stuff, and I always joke about this, if you sent me something on Facebook that says, oh, they discovered lymphatic drainage, I will unfriend you faster than I can snap my fingers because the history of lymphatics is huge. And we could go all the way back to like when they first discovered lymphatics and they separated it out from the cardiovascular system. But if we sort of looked at lymph drainage and said, okay, when did it originate? Like this is over 100 years ago. Okay. So A.T. Still, who is Andrew Taylor Still, he was kind of this osteopathic, he's like, we consider him kind of like the father of osteopathy. And so he sort of, started this whole concept of working with bones, cerebral spinal fluid, like all the different pieces and working them together. And near the end of his life, he was like, man, this lymph stuff is really cool. I'm getting old. I don't have the amount of time to really focus in on it. And so he actually had an apprentice, and his apprentice or somebody who worked with him is Frederick Millard. And he started working with A.T. Still, and he continued the research and the evolution of lymphatic drainage from A.T. Still after A.T. Still passed away. So first off, I'm going to clarify this. Lymph drainage has actually never been considered massage. So this is where it's actually kind of been, I hate the word bastardized, but it's just been manipulated into this weird sort of alternate, everybody thinks, oh, it's massage. It is absolutely, frickalutely not massage therapy. So Frederick Millard was the first dude who really kind of called it lymphatic drainage, and that was in 1922. There's Earl Miller, and Earl Miller, he is huge in the osteopathic world. He created these things called lymphatic pumps. Some of them are still taught today in osteopathic schools. Emil Vodder, most people know about Emil Vodder. And in 1936, he actually presented manual lymph drainage at a cosmetology conference in Paris, talking about acne and sinus stuff. So what most people know about Vodder, they go, oh, he's big in the lymphedema world. He actually, that was not his original intention, although it has evolved into that. But he started with like cosmetics, which is in a great sense of like, how do you keep the skin healthy and how do you keep it clear and how do you keep it clean? Great. Dr. Chikly, Bruno Chikly, who's I work with a lot, he sort of, it's an evolution of all the techniques and all the foundations that came before him. But, he sort of came up in the 1990s kind of idea. So I actually tried to reach out to him today to find out like when he officially, you know, announced the development of lymph drainage therapy, but he's teaching right now, so he wasn't available. But this is the thing. Massage therapy and what most North Americans know as massage therapy is called Swedish massage. So when I go to massage school, I'm learning Swedish massage. So that's like, the kneading and the big movements all over the entire body. But it does encourage circulation in general. Absolutely not going to deny this. And when we say circulation, means blood, and in turn does have an effect on the lymphatic system. However, in Swedish massage, there are actually no techniques that are very specific to just working the lymphatic system directly. It's indirect, it has an absolute effect, but it's not specifically working with the unique patterns and pathways that are the lymphatic system. So, what you get in massage where they do these big sweeping kind of moves over your whole back or all the way up your arm and that's called effleurage, and it's very nice, but it is not lymphatic drainage or lymphatic drainage, however you want to say it. Okay, so there is a very big difference. And I've been very blessed. I teach all around the world, which is one of my favorite things about my job. I've gone for Chinese massage. I've had Malaysian massage. I've had all these different styles, Taiwanese, Thai, all these things. And yeah, they are really good at muscles. Not many of them affect or specifically address the lymphatics. And thanks for Google Translate. I do ask that question almost every time. Most of the time they look at me like deer in headlights. But there is no specific lymphatic work unless you kind of look at traditional Chinese medicine, and they do look at like the humors or the lymphatics. So there is that. So let me just clarify a couple things about your lymphatic system because to understand why we're different, you need to understand how the lymph system works. Okay. So first off, we have our beautiful heart, and our heart pumps out oxygen, water, nutrients to every cell in your body. Okay, there's a few exceptions, but I mean like the majority. And we used to think that all the waste products that our cells gave off would go into the venous system, which has now been kind of proven incorrect. We used to think that like 92 to 98% of all the waste products would go back into our veins. About 14, 15 years ago, they actually disproved that. And now they say anywhere between 92 to 99.98% of all the waste products that your tissues actually make go into this really cool system called the lymphatic system. So even though we knew the lymphatic system has been there, and we've known this all the way back to Aristotle and Hippocrates, honestly, they didn't understand the extreme value of the lymphatic system until 15 years ago. So if you find that information on Facebook, you can still send it to me. I won't unfriend you. It's fine. Okay. However, one of the cool things about your lymphatic system is that to get fluid into it, you go into these little tiny small vessels called lymphatic capillaries. And that's the picture that you're seeing on the upper right-hand corner of the screen. So all these like gray cells, which are not really gray, but for like, learning purposes. So there's your lymphatic cells kind of all overlap. And you see these little lines that are connecting the cells to the green lymphatic vessel wall. Those are called anchoring filaments. And anchoring filaments are what kind of is like super unique about your lymphatic system. No other vessels really have this. And what they do is that whenever the tissue around a lymphatic vessel or a lymphatic capillary is moved or pulled on or pressed on or what have you, it creates gaps. So the bottom photo, now I apologize, it's a crappy photo. Some of like the best lymphatic like pictures are actually kind of old, despite the fact that we all think it's new. But when there's tension on those filaments, it actually creates a beautiful gap in between those cells and fluid can rush in. So one of the things that makes lymphatic drainage different than effleurage or massage, etc., is that we actually stretch the tissue. It's really important that we have a certain amount of stretch on the tissue to facilitate the movement of the lymphatic fluid, which before it's in the lymphatic fluid, we just call it interstitial fluid, which is still a great thing. But if we don't move that fluid out of the interstitial space, you just get swollen. You get edema. You're all poofy, and nobody likes to be poofy. And so we want to encourage that fluid to leave the interstitial space and get into this lymphatic vessel to drain it away. And your lymph system's job is to clean it, reabsorb any extra water you have, and move it so that way we can eventually put it back into blood circulation. So your lymph system is actually not a waste. I hate that people always say it's like the sewers, and I'm like, oh, it's not really sewers. That's more like that's your bowels, and that's a different storyline. But lymphatics is like this amazing reducing, reusing, recycling kind of process. And it's your immune response and everything that's combined. So you can't you can't do lymphatics with lotion. If I can't stretch the tissue that little bit and actually focus on moving these anchoring filaments, I'm actually not moving as much fluid in. I'm just kind of like pushing it past. So unfortunately, a lot of, old school or traditional schools kind of go, well, if you just take your hand and you put on the skin and you just kind of slide it over, they have this visualization that it's like taking water off the surface of a table. Well, if I just wipe it, the water goes away. Lymph system doesn't work like that. So we need to actually help facilitate moving the fluid from this interstitial space here and allowing it to slip in to our lymphatic vessels so it can move up and actually make its way out of the vessels and get eventually back into your bloodstream. Okay. So there's different kinds of trainings. So we're going to talk about different kinds of training. So first off, I am a very proud massage therapist in the province of Alberta, in the country of awesome Canada, and I absolutely love being a massage therapist. And on top of that, I take a lot of pride having been an instructor for three different schools, and they were all very different kinds of schools too. So knowing that, I have a kind of a diverse background on different types of schooling that is available out there. Okay. So there's a couple problems right now in most places around the world. Okay. Nobody's really like solidified this 100%, but Canada wide, every province is kind of different. Like there are provinces in Canada that are regulated that have said, look, to be a massage therapist, you need to have 2,200 hours of training and you need to go through an examination process and have completed that and then, stay in good standing. But provinces like Alberta, we're not regulated. So a massage therapist could, by definition, go to a school, get 1,000 hours of training or less, and put a shingle up and say, I'm a massage therapist. Now, the cool thing is the insurance company actually got kind of smart to it and said, look, we're not going to compensate you if you go get a massage from that 1,000 hour guy down the street. But if you go to that 2,200 hour therapist over there and you get a receipt from your session, we'll reimburse you for that. So actually, the insurance companies are the ones that have forced kind of like a standard, which is an impressive thing because you would think it's within the own, the actual profession itself. So not all provinces are trained or regulated equally to every other province. Okay. So the second thing is that there's different kinds and lengths of schooling. Some are only 1,000 hours and you can get that done in 6 months. Some are 2,200 hours, which is what I did over 2 full years. Some are 2,200 hours, but you do some in class, you do some distance learning, some of it's online, and then you come in for exams. Like there's different styles of schooling. Okay. So not all of them have like 2,200 hours of actual hands-on in person. Some of them have a variety of stuff. So it does, unfortunately, lead to also a slight discrepancy in what is taught in those programs. So the reality is, in all the three schools that I taught at, one was, 9 to 5, 5 days a week, 2 full years. The other one was sort of a more of a distance learning. You come in once a week or once a month for a couple of days. You do the hands-on part, and then you do all your, mental sort of learning and anatomy, phys, and all that kind of stuff at home. And then I went back to a full-time kind of program, but COVID, of course, has changed things. So there is like, there's a variety of hybrid programs. So the thing that happens though is that in all of those, I've experienced the exact same thing with lymphatics, which is if you get more than, I would be shocked if you got more than 8 hours out of 2,200 hours of training. If you got 8 hours on lymphatics, I am so impressed, which is not saying a lot. So in my experience in most of the schools, because I've also, contacted a lot of schools saying, hey, I'll come in, I'll talk to your students, let's talk about the differences, let's talk about, the basics of training. And most of them go, no, that's okay. It's not really necessary. It's not a requirement really to dive into it. And sometimes I can agree with that because it's not a massage technique. It's an added technique that a massage therapist could learn, but it's not a foundational technique. The other downside is that unfortunately, in most of these schools that I've met, the instructors who are teaching the lymphatic components do not have additional lymphatic training. And so they are learning from a textbook. And there's one beautiful textbook that is kind of used as, I don't want to say like the treatment massage Bible, but it is. Um, it needs updating. But out of this over 800 pages of book, there's 3 pages on edema. And out of those 3 pages on swelling, one of them has 3 paragraphs on how to do the technique. And a lot of instructors might use that just as the basis of their knowledge base. And so, again, as a massage therapist, your job is not to know everything, and it's impossible. But this is, you do get an introduction to it. And that's really important to note. There's an introduction to it in massage school, does not a lymphatic therapist make. Okay. The next level up would be becoming a lymphatic therapist. So whether they're a manual lymph drainage therapist, a lymph drainage therapist, a lymphatic drainage or lymphatic technique therapist, I don't care. All different schools have a different term that they use, but there's lots of different schools, and I'll show you a list in a moment, okay? And same kind of thing. So not all programs are designed equal because there's no regulating body that says if you're going to be a lymph therapist, you need to have this knowledge, and this knowledge. Okay. The great part though is there is a lot of similarities. So we'll look at that. So again, some of them are very condensed and some of them are spread over a longer period of time. So I have obviously trained with the Chikly Health Institute. That's who I teach for. I have taken programs through VODR and through the Academy of Lymphatic Studies, all wonderful programs, and they all have the same intention is to help with swelling. So I can't really, I wouldn't bad talk any of them. There's differences in learning though. So it depends on you as an individual what works best for your learning style. So for example, you could take a 4-day workshop on the theory of lymphatics and then a 4-day in-person for the actual hands-on. Our program is like you do 4 days for level one. That includes theory and hands-on. And then level two, you go to, different structures. And so there's different ways of doing it. Some schools are all hands-on, okay? Some of them are only in person. Some now are starting to say, oh, no, you could become a lymphatic therapist online only, which I have huge issues with, only because it's a very specialized contact. The technique of doing lymphatic work is nothing like massage. Being a massage therapist gave me the ability to palpate and feel tissue, but it did not prepare me for being a lymphatic therapist. It allowed me to listen to my hands, which allowed me to listen to somebody's lymph and work with the individual, movement and everything. But it's not a massage technique. I can't really emphasize this anymore. It's not the same thing. And if you've had lymphatic drainage, you would understand. And if you have, then it's not a massage. That's why you'll never hear me call it lymphatic massage, because it is not. So. So there's different schools of training for lymphatics. So in Canada, these are the main 5 schools. If you want to become a lymphatic therapist, cool. The Academy of Lymphatic Studies, they are a traveling school. They will come to different provinces, different cities. Chikly Health Institute, that's me. But we have other instructors that come up as well. Close, Norton, and Vawter School of Canada. All of these are schools that will teach you how to be a lymphatic therapist. So the different kinds of conditions that we can work on vary, okay? There's a difference between a lymphatic therapist and a lymphedema therapist, which we're going to get to in a sec. Okay. So this is lymphedema therapy. So to be a lymphedema certified therapist, we're called CLT, Certified Lymphedema Therapist. Okay. There is a current standard. However, it's not a requirement. Oh, it's hard to say this. It's not required for us to practice to have that current standard. Okay. So this is the thing. There is a current standard that's set out by the Lymphedema Association of North America. Okay. And it is 135 hours of total training. So many different schools have different training, but some of them are more condensed. The Academy of Lymphatic Studies, wonderful school. But it's 10 days solid of like anatomy, physiology, wrapping, bandaging, everything in 10 days. And I did it. And my brain could have exploded. I think parts of me were left at that class, but it's so much in 10 days. But if you're trying to be certified and fast, that's great. Like it's super condensed and that's great. Um, Differences in levels. So some schools are fully hands-on, while some of them have more of the anatomy, physiology, the sciencey pieces being more distance learning, and then there's the hands-on part. The thing is that all schools that are a lymphedema training program must teach the anatomy, physiology of the lymphatic system, the pathophysiology, why does lymphedema happen and all of its issues, decongestive bandaging, how to use compression garments and how to do measurements for compression garments, different kinds of surgical interventions. Skincare is a huge part of lymphedema management. How do you educate and keep your patient on board with everything? Exercises, self-care. This is what differentiates somebody who's a lymph therapist versus a lymphedema therapist. Okay. So sometimes people call us CLTs. We do CDT, which is complex decongestive therapy. Sometimes it's complete or complex or, decongestive physiotherapy. There's so many terms. And why they all just can't get on the same board, I still don't know. But anyways, so lymphedema is different. It's not swelling because of an injury or swelling because this is the lymphatic system is exhausted. The lymphatic system has been damaged in some way. Or maybe somebody was born with an imperfect lymphatic system. You see the cute little legs on the far right there with the diaper. Some people are born with lymphedema. And so a lymphedema therapist job is being able to differentiate between trauma and edema versus lymphedema. There's a very, very big difference. Okay. So the Lymphedema Association of North America, this is their current requirement. So since January 1st, 2022, the top section applies. So you have to do 45 hours or approximately a third of 135 hours. And they have all these different ways that they can have this material delivered. And it's broken down a little bit differently because of COVID. So because a lot of people needed to continue getting training during that period of time, they're like, okay, we're allowing you to be synchronous remote, which students have to be on site listening to the teacher at a very specific time and everybody's interacting and there's questions or, you know, maybe it's a recording or maybe it's a video, I don't know. And so this is different than what it was prior to January 1st, but the amount of knowledge is still required the same, 135 hours. 45 hours of it needs to be theoretical instruction. So, like, explain the difference between primary and secondary lymphedema. What's the difference between chronic venous insufficiency? How would you treat lipedema different than lymphedema? What's the difference between class one, two, three, four, five compression garments? When do you use decongestive? Like, all that theory is more than a lymphatic therapist would know. Lymphatic therapist, you got like swelling because your eyes are puffy from allergies, great. Lymphatic therapist. Lymphedema, though, you need to see a lymphedema therapist. There's a very big difference. Okay. So, when I said before that it's not regulated, is that we have this beautiful Lymphedema Association of North America. But for example, in Canada, same thing kind of goes in the US, to be honest. Unless you're working for the government, nobody cares if I actually was certified with LANA. Because here, I'm a massage therapist providing lymphedema therapy. And if you came to me, I would give you a receipt for lymphedema treatment as a massage therapist. They don't care if I'm they don't care if I've been certified by LANA. So if I'm certified and the girl next door to me isn't, it doesn't make a difference. It's not a required certification. What's really cool and important, though, is that when I look at lymphedema therapists, I want to know where they went to school. And I want to know, was their school LANA accredited? So there's schools that pop up all the time. Lymphatics has become a really big buzzword. Everybody is looking for a lymph therapist. So guess what? All therapists want to be lymphy. They want to have the lymph knowledge to be able to go, oh no, I can see you. Bring your money and your business to me. And I understand that. I do. So I had my businesses, I did understand. Having said that, lymphedema is very, very unique and it requires this certain amount of skills to treat it safely and effectively without wasting patients' time, money, or I'm not even gonna lie about this, emotional hope. And so I look at lymphedema therapists and I go, where did you go to school? Now, if you show me one of these schools, then I know that you became a lymphedema therapist and you have the foundational knowledge that I would feel safe referring a patient of mine. So since I, closed my clinics and now I teach a lot, I'm not around in Calgary as much as I used to be, and I have to refer to other therapists. And to be honest, I don't have anything against any of these other programs. So just because I teach for Chikly doesn't mean that the other programs are bad. So if you come to me and you say, hey, I need a lymphedema therapist, and I can't see you and so on, I will go research the therapist in the area and I'll go, here's Susie Q, and she went to the Norton School. She's a lymphedema therapist. Norton School is accredited with LANA. LANA has approved their program that it met their standards of being a certified lymphedema therapist. So I go, groovy. I like that. Okay. So how do you know if you need a massage therapist, a lymph therapist, or a certified lymphedema therapist? So these are great questions, and there's tons and tons of conditions that we could talk about in situations. So if you have a sprained ankle, okay, everybody sprained an ankle at one point. Okay. There is swelling that happens with a sprained ankle. Now, that is a short term, what we call acute injury. And so there's swelling that happens from the trauma, and then the swelling will go away on its own. But if you worked with a therapist, you might get that swelling to go down faster. So, to be honest, some of the basics, like even, that 2 hours of training that they got, a massage therapist will probably help you reduce the swelling of a sprained ankle. A lymph therapist will probably be able to get it done faster for you. And a lymphedema therapist, kind of the same as a lymph therapist in that situation, because we're not going to use all our extra tools in our tool belts. I'm not going to go pull out, my decongestive bandaging for a sprained ankle. I might, my lymphatic taping skills, just to sort of speed it up. But again, a massage therapist or lymph therapist would be great. Somebody's pregnant and they've developed edema. It could be in their face, maybe their hands, their feet. Massage therapist, it's going to help with muscles, going to help with pain, discomfort, all those things. Love me a good massage when I was pregnant. And the skills that they have will also help with the edema. Lymph therapists would probably be more effective. Between lymph therapists, certified lymphedema therapists, you would get very similar kind of treatment approaches. Okay. Chronic venous insufficiency is a different condition all on its own. So chronic venous insufficiency is when your veins get tired over time and they just get weaker and weaker. And we all know somebody who has this. So I want you to like think of the people you know and go, okay, who is that person that at the end of the day their ankles are swollen and they're tired and their legs are achy and their feet are swollen? They put their feet up. You can see like bands around where their lower ankles are around their feet. And then, but they go to bed and they wake up the next morning and their ankles look fine. And you're like, how the hell did you do that? Like, that's kind of some miracle. What it is that the lymphatic system is tired over the length of the day. The veins are tired. Everything kind of congests into the feet because gravity. But then we go to bed. And when you go to bed, because you lie horizontal, most people do, you lay horizontal, the lymphatic system and the venous system can catch up and help move all that fluid while you sleep. It's like magic. And you wake up and your ankles look great. So chronic venous insufficiency swelling is more of like a warning to you saying, hey, excuse me, I can't move this fluid during the day. I don't know if you can notice this, but I'm really swollen at the end of the day. Can you help me? Now, that's a warning sign, but most people go, oh, it's fine. The swelling goes down when I go to bed. So what's the problem? I can totally handle this. Problem is over time that gets more and more exhausting, and it gets to a point where it actually won't move that fluid on its own, and it just kind of stays in the lower extremities. So, massage therapists might be able to help a little bit in the early stages, like when it's still recovering, etc. A lymphatic therapist, absolutely, they have the training specifically to lymphatic pathways to support the lymphatic movement, stimulate sort of the vacuum effect that happens in the lymphatic system, but also, help give some home care. A certified lymphedema therapist will probably get a little bit more because we've got more tools. When you start seeing chronic venous insufficiency, it probably means you might also need some sexy compression garments and, maybe, some tape and, we'll jazz you up. It's sexy. We don't mind helping. So there's tools, right? Every level of training, they get more tools. Okay. Normally we charge just a little bit more the more training we get, but that's to pay off all the schooling, to be honest. But that's how it kind of rolls, right? Allergies, honestly, all three of these will be able to help. Allergies, because of how the inflammation is, the pattern, especially on the face, a lymphatic therapist will have probably more success than a massage therapist. But it depends on how smart your massage therapist is, if they can put two and two together from the little bit of training that they get in school. Um, but there's a lot of things that, as a lymphatic therapist, we can do to help resolve the swelling from allergies a little bit quicker and help maybe prevent some of the extremes of an allergic reaction. Talking more like seasonal stuff, not like a bee sting, but there's varieties. Lymphedema, 100%. If you have lymphedema, you should see a certified lymphedema therapist. I completely 100% understand that lymphedema therapists are hard to find. So I'm not trying to pretend that, they're everywhere. They're not. from running my clinics and having lymphedema therapists working for me and with me, to be honest, it's if I train more lymphedema therapists, I can help more people, which is why I'm doing more teaching now. So it's a specialized skill and it is more money and it is more training and there's more work in it. It's not an easy thing. A lymph therapist can work on somebody who has lymphedema, but the problem is that they're going to do the hands-on part, and then as soon as you stand up, the fluid goes right back. A lymphedema therapist is not just hands-on skills. It is a whole bucket of extra skills that we have together, and it can include a huge variety of techniques. And so, like I said, I've talked about like lymphatic taping, we can talk about pneumatic compression pump systems, we can talk about decongestive wraps or circade wraps that are more unique that have like Velcro, or we can talk about elastic wraps. We can talk about there's so many like tricks because it's not just moving the lymph. Once you move the lymph, that's one thing. But as soon as they stand up, because the vessels and everything are damaged or weak, gravity just pulls it back. It is a very hard condition to manage. It is not an easy thing, and it is extremely frustrating as a health professional to hear massage therapists come out of school saying, "Well, I learned lymph drainage so I can work with lymphedema," and waste patients' time and money. And honestly, those patients come and see us like after like 6 months of going, "Well, I've been seeing this massage therapist, and they said they have lymphatic training," which means 8 hours of schooling in 2,200 hours over 2 years, and it's just getting worse. And I'm like, well, because you might understand how to work a little bit with a completely beautiful, intact, fully competent system, but that's not lymphedema. Lymphedema is like a rare, unique condition beast. It is unpredictable and it is unique for every single person. I have never seen two lymphedemas act the same. Whether if somebody, I have one patient who had four lymph nodes removed from her left axilla and another one who has four removed from the exact same armpit, they will react so different from each other. And when they start to swell and how they react to treatment and how they do their home care and if they're compliant and skin issues, you cannot predict lymphedema. And I honestly can't say this enough, but if you're not a lymphedema therapist, do not touch a lymphedema patient. Like, if you're trying to manage the swelling and you're not a lymphedema therapist, you're probably not going to make it a lot better, and there's a chance you could make it worse. So, that's me on my little soapbox. Post-surgical swelling. It really depends on what kind of an amount of swelling you're seeing. Some massage therapists they've done scar training, they've done fascial work, they know how to work with scar tissue. And to be honest, fascia and lymph, you have to treat the two together. You can't just treat lymph and hope for the fascia to let go. And you can't just treat fascia and hope that it'll just move the lymph. To be a really great, I think, lymphatic therapist or lymph therapist, you need to do both. So post-surgical swelling is kind of a trick question because depends on how big the scar is. Depends on what was done surgically. How deep of a treatment was it, right? If somebody had a knee replacement, man, a lymph therapist or a certified lymphedema therapist, you're going to have to pull out potentially some really cool tricks out of your bag. If it's like, stitches like the ones I had on my face, a massage therapist will do a phenomenal job because, again, the complexity of what has happened is very different. If I look at C-sections or I look at shoulder reconstruction, I want more training to help move the lymph because at every level, the lymph moves in different pathways. You got to think of the human body kind of like a landscape, like you have rivers you can see on the surface, and then there's an underground river, and then there's even a deeper underground river, and they probably all go in different directions. That's your lymph system. They're all trying to get to the ocean eventually, but they're going to find different ways to get there. So post-surgical swelling depends on the complexity. Okay. So, how do you find the therapist that you need? So, the first thing is you got to research the condition that you have, or if you're a therapist, the condition of that of your patient. So, there's a couple things. And if you want to screenshot this, I'm totally cool with it. So first thing, if it's more than basic edema, okay, edema happens because of trauma or injury, or you can have like generalized edema, whatever. But if it's more than just basic edema, then you probably need a lymph therapist or a certified lymphedema therapist, depending on the extent of the edema. Okay. Now, if it's a chronic and non-resolving edema, which means somebody's had this swelling for a long period of time, it is not going anywhere fast. Even with, a massage therapist or a lymph therapist doing a little bit of work, it's not resolving. You need to step up the level of training of the therapist you're working with. So a lymph therapist, an advanced lymph therapist who's done a lot of training, or even a lymphedema therapist, that's going to be your go-to, okay? Long, chronic, non-resolving edemas. A massage therapist can assess it and sort of subjectively observe it, but to treat it, it's more than just, general massage techniques and the little bit of lymph stuff that you learned in school, okay? Now, this is really important. If there has been even one lymph node removed, okay, I say this with love, but one lymph node removed means you have lymphedema. Stage zero, okay, you don't have to have swelling yet, but stage zero, you should be seeing a certified lymphedema therapist to assess and make sure we have an idea of what you look like before you swell, because lymphedema, like I said, it's a unique little conditional monster. Is I don't know when you're going to swell. I don't know how much you're going to swell. I don't know what's going to cause you to swell. And I don't know, you know, if it's going to be the same as anybody else that I've seen. So honestly, the best thing you can do is start looking at supporting your lymphatic system before you start to swell. Okay, this is prophylactic. Like how do we set a phenomenal situation for your lymphatic system to go, I don't need to swell. I've got all these options. I can move the lymph here. I can do these alternative pathways. I'm a smart cookie, and lymphatic system can just be doing its own thing. And honestly, if you start treating it prophylactically, then if you do start getting a little bit of swelling, we can be right on top of it. We don't have to be chasing after 6 months of you swelling and not being able to get it under control. And now you've had like a cellulitis, inflammation, you've had a reaction, something. So there's that. On top of that, radiation really does damage lymphatics. So radiated tissue, lymph does not move through radiated tissue. There's been some amazing developments in radiation therapies and approaches, but up until this point, we are still seeing that the lymphatic system does not move through radiated tissue. So we have to find some other cool way to, get that lymph to find its way back to the venous system, and we have to get that lymph to go through lymph nodes somehow. So radiated tissue, you should be seeing a certified lymphedema therapist. Lymphatic therapists generally are not taught how to deal with post-oncology movement of lymphatic fluid. Now, if there's a program out there that is, congrats. I'm excited. I'd love to know more about it. But up to this moment, I haven't heard of a program that is for anything less than a certified lymphedema therapist that teaches how to work with radiated tissue. So I'd love for somebody to prove me wrong. That would be great. The last one, if there's a positive Stemmer's sign. Okay, so for those who are not a therapist or a lymphatic therapist, most massage therapists don't know Stemmer's sign. Stemmer sign, if we do it on our hands, okay, if we thought you might develop lymphedema in your arm, we went to the base of your second or the base of your third finger and we try and pick up the skin, okay? So if you can pick up the skin like this, that is a negative Stemmer sign. That is a good thing, okay? That means you don't have lymphedema. If you tried to do that and you can't pick up the tissue, comparative of one hand to the other, then that's a positive Stemmer sign. It's not a guarantee that you have lymphedema. What it means is that the tissue has become thickened or fibrosed, and it's making it more difficult for you to pick up that tissue. That would be a very good indication, also in combination with any kind of pre-existing history that we don't know about, to make sure you see a lymphedema therapist. If we're doing this on your feet, that's the base of your second toe. So where the second toe attaches onto the foot, if you try and pick up the skin and you cannot, that is a positive Stemmer's sign. That would be a very, very good reason to go and look for a certified lymphedema therapist. Okay. So if you are going online and you're seeing websites and it says they do lymph drainage therapy or they do lymphatic massage, the first thing you need to do is call and ask questions. And you need to look up the bio of that therapist and go, where did they go to school? What kind of training did they have, right? All massage therapists in school learn how to do fascial work. All massage therapists in school learn how to do joint play. It doesn't mean that they are a myofascial therapist or that they're a joint therapist. It means they got introduced to it in school, and that's your foundation. If you want to go into more training and start working with those conditions very specifically, you need to have continued educational credits. So you can go to the Alberta Lymphedema Association. You can go check out the list of all the certified lymphedema therapists in Alberta. If you are a therapist or you know a therapist who's not a lymphedema therapist but really wants to be, we actually, as an association, provide scholarships to therapists who want to become lymphedema therapists. And we actually provide up to, I think the number's now around $3,000 for them to go and take training. So that way we can have more lymphedema therapists in this beautiful province because we have a decent number, but we are a big province and we are spread out. And unless you live in Edmonton or Calgary, you're going to be very hard to find a therapist that can treat you. And heaven forbid you live north of Edmonton, you're going to drive a long ways to find somebody who's certified. So for safety reasons, you do. You really want to do some research and find the right therapists. So I started the LymphyCon health conferences because all the lymphatic conferences were in Ontario. And I love Ontario, but it's not close to Alberta. And so this is our fourth annual, and this is a 2-day conference. It's designed for patients, it's designed for therapists, it's designed for, we have garment fitters that are coming, we have doctors, we have researchers coming, family members of patients. And it's 2 full days of different talks, and you get to pick which talks you want to attend, what topics are interesting to you. Over 2 days, we have 3 rooms running full time. So there'll be talks in 3 rooms, and you can't be in more than one place at a time. And so we record all the talks. And then with your ticket, you also get access to all the talks that are recorded on a platform for a year after the conference. So if you want to learn about, dealing and looking at the microenvironment of the lymphatic system from a research point of view, because you're geeky like me, then Dr. Spencer Gibson's coming from the University of Alberta, and he's going to do a talk on that at LymphyCon. If you want to talk about like clothing restrictions and how clothing modifications make it more comfortable for patients who have lymphedema, well, we've got Naomi Dolgoy, and I can never say Eater's last name because it's really beautifully complicated in my mouth. But anyways, they're going to talk about clothing complications. We're going to talk about exercises that are beneficial for. So we talk on all different topics, some that are for therapists, but anybody can attend. So if you're a patient or you're a practitioner or you're a family member, you can come for the whole time. So it includes food, so your lunches are covered as well. And it's 2 full days. And if you don't want to come for the whole thing, Saturday night, we have a lymph social. And I'm going to talk about the difference between lymphedema and lipedema. There's going to be a lymphedema support group run by one of our beautiful board members, Jennifer McNish, who is head at the CALS Center here in Calgary, the Calgary Ambulatory Lymphedema Service. She's going to head up the lymphedema support group. We have a lipedema support group. There's vendors from all the different big companies, Juzo, L&R, Medi, Mona's going to be there. Honestly, anything and everything lymph. And my goal is just to make it as accessible as possible for as many people as possible. So if any of those things are of interest to you, I would love to help you get access. Otherwise, I am good to answer some questions if there are any. I'm just going to stop sharing. And I apologize because I was unable to see the chat while it was going. So I'm gonna go back through all your beautiful comments.
No worries, Robin. I'm ready to relay you the questions, so don't
Go for it,
worry.
girlfriend. I would love to answer
I
it. And
just
you guys are
wanted to
more than welcome.
reiterate.
You
I
guys can
wanted to
come.
reiterate a couple things
Yeah,
that you said that I did mention in the chat as you were going along.
go for
One
it.
thing is that we do have a list of certified lymphedema therapists, LANA approved institutes on our website. So I put the link there. And if you're a CLT and you want to be added to that list, please contact us because that gives us more options to give to our members and the general public. If you're
Mhm.
a patient, please refer to that. If you're looking for a certified lymphedema therapist for all the reasons that Robin just mentioned. And then on the scholarship as well, we are focusing on rural areas for those applications. So if you
Okay.
are in Edmonton or Calgary, you're welcome to apply. You still have a chance to get it, but we are really prioritizing rural applicants. And then we also added a new scholarship in addition to the $3,000 that Robin mentioned, don't worry, for becoming a CLT. But we have a new one that's for existing CLTs, and it's up to $1,000 if you want to take a certification that will re-up your training or help specialize you in an area where we're getting a lot of questions. So things like pediatric lymphedema, neck and head lymphedema, truncal lymphedema, that kind of thing. So I just wanted to add those there. So the links are in the chat too.
Yeah,
Um, in terms of questions, Robin, that was like so amazingly laid out and so engaging. So thank you.
my
Um,
pleasure.
we have some difficult ones here. So
No,
Diana asked,
I see
uh,
Diana's one.
how much are CLTs learning about mast cell activation syndrome, MCAS? I just went to a webinar by a specialist who treats it, and they mentioned that MCAS can be a major cause of swelling and even weight gain.
Yeah. So absolutely, CLTs are not generally trained in mast cell activation syndrome only because their major focus is lymphedema, right? So for the amount of time that they're doing their training, they really have to super focus on lymphedema because there's so much to do with it. I have seen more programs that are for lymphatic therapists learning about mast cell activation. And to be honest, it's normally the more advanced therapists. So, for example, in our curriculum, we do talk about mast cell activation syndrome because we do have a course that has to do with allergies and toxins and conditions where the immune system is very hyperactive and I've treated a lot of mast cell activation syndrome patients and have seen some really great results. You just have to be careful not to work during a flare. But it is not something that is generally trained to a lymphedema therapist, and it's just they don't have the time yet. So I think it's going to be something that's going to be more prevalent, but I would really love for lymphedema programs to include more about lipedema, to be honest, at this point. So I'm trying to I'm choosing my steps, my friend. I'm choosing my little battles. So I'd love to see more about it as well in the curriculums. I talk about it in our programs, but I've only ever seen it in more advanced lymphatic because they haven't been able to really show 100% that by doing lymphatic drainage that it makes a huge difference for MCAS patients. So I'm waiting for some of the research to kind of support it a bit more before we can go lymph it out. So does that help?
Absolutely. And I agree that all of the CLTs need to know what lipedema is and be trained in that. That
Yeah.
is, if you don't already know, I'm a volunteer with Lipedema Canada, and I'm just saying the amount of increase in people we've seen even asking about this on the Lipedema Facebook page and the website has increased like tenfold in the last 6 months.
Yeah.
So if you don't already have a knowledge on lipedema, I highly recommend reaching out to Lipedema Canada to learn more because you're going to start seeing a lot of us.
Yeah. Well, and that's like I've been working with Lymphedema Canada a little bit, trying to see if we can create a program that's very specific for lymphedema therapists to learn specifically. Like we do teach, like how I was saying, massage therapists learn like 2 to 8 hours in 2,200 hours. The amount that a lymphedema therapist learns about lipedema is kind of the equivalent. And so there is more and more that is being added in, and I'm starting to do more about lipedema in my program. I haven't seen any big expansion in the other programs. Doesn't mean it's not happening though. So yeah,
That's really good.
I'm trying to work with Emma a little bit to see if we can make a big push.
I love
It's a
to hear
very
that. Thank you.
yeah, yeah. Oh, and look, and you're all connecting with Joette and everything like that. That's awesome.
Yeah,
Your little
amazing.
conversations. I like it. Okay.
The other questions, Robin, were around volunteering at LymphyCon. So I did mention
Oh,
that like we can use if like I know Joette for sure because she's a scholarship recipient. They are definitely welcome to volunteer at our booth, like the association booth, but then
mhm.
maybe you could comment if there's other volunteer opportunities at LymphyCon that are still open.
I do have a couple spots for LymphyCon volunteers. So volunteers for LymphyCon generally mean that you are on site and helping answer questions and help people find which rooms they need to be in and know which where everything. Downside though is we're only 4 years old as a big conference, and which means I don't have a lot of funds. So I can't pay you. I know it's a volunteer thing, but I can't like pay for like accommodations or anything else. But
They
you get
get
to come to the
lunch though, right?
lunch is included and all the snacks and all the coffee and all that kind of stuff. Like, and there's like a brunchy kind of little thing in the morning. And if you stay for the Saturday night, there's stuff. Lunch is absolutely included, but just, to sort of set expectations and people go, oh, well, can you put me up in a hotel room? No, I can't yet. I'd love to. So I'd love
Hmm.
to be able to start paying my speakers, but really most of them are just doing it to help spread education and information and answer questions. And um, honestly, the list of speakers this year is amazing, and I'm so excited. So, and if you can't make it in person, you can still buy a ticket and you can still get all the recordings. So if you can't make it to Calgary at the end of April, I get it. But you also might be able to, if you buy the ticket, you might be able to, you'll still get all the access to all the speakers and all the talks. It's held on the Massage Canada. They have a platform. And so they do all the recordings for
Amazing.
us. Yeah, it's amazing. But yes, if you wanted to, I'll put my cute little email address in there.
Yeah,
And
yeah.
you guys, if you wanted to
People can
volunteer, you
reach
can
out
definitely
to.
reach out and I would love to chat with you and see what might work. So,
Awesome.
yeah.
Okay. That's great. Thank you. So people can reach
Yes.
out to you directly if they want to volunteer for the
Yeah.
conference. And then we have a question from Fran. Thank you, Fran.
Okay.
I'm
Yeah.
not a therapist, so a couple of points I need clarifying.
Okay.
One, I've come across a couple of cases where the therapist has done part of the 135-hour course. Is there any consistency among school as to what someone who only did first session, would they be considered lymphatic therapists? So
No,
this is a question we get a lot because there are multi-part programs with both Chikly and Vaughter.
right. So for example, like with the Chickley program, you take LDT level 1, 2, and 3. And even doing those three does not make you a lymphedema therapist. You have to take those three, and then you also have to you have to take the 7-day lymphedema therapy certification. So taking level 1, 2, and 3 with me means you're a lymphatic therapist, not a lymphedema therapist, but a lymphatic therapist. There's a difference, right? If somebody's only taken part, so if you go, let's say, to Vaughter School, they have manual lymphatic drainage 1. That's to be a lymphatic therapist, not a lymphedema therapist. And so you really do have to look at if they don't have the 135 hours in the lymphedema certification program, you got to be very specific. The lymphedema certification program, they are not a certified lymphedema therapist, but they might be a lymphatic therapist. So that's the thing. It really depends on the program, and until there's like a strong consistency, it's super frustrating.
I actually
Um,
did not even understand that difference until today.
okay,
So thank you for that.
yeah.
I'm
So
so grateful for that.
yeah, so if you go look at any of those schools, if you look at Norton School or the Academy of Lymphatic Studies, they'll have basic MLD, which is basic manual lymphatic drainage. And if they take that, phenomenal. Then they're a lymphatic therapist. So they can work with swelling, they can work with sore ankles, they can work with eczema or allergies or swollen face from sunburn, etc. But they can't work with lymphedema. So a lymphedema therapist has all the biggest questions I would ask. First off, do you know how to do bandaging and wrapping? If they go, what? Walk away. It's not a lymphedema therapist. If they don't understand compression garments, it's not a lymphedema therapist. There's a big difference. And so until I have a couple aces up my sleeve right now that I'm working in different avenues to see if I can flip this on its head a bit and make it easier for access for patients and to recognize the differences. But until that happens, the onus a little bit is more on the patient than it should be. And that's extremely frustrating. So, but yeah, like you're more than welcome to send me questions. Jeannie, she's like our amazing like head manager kind of response coordinator, awesome woman. You can always send questions to the association and she'll send it to me or Jennifer and we'll do our very best or even PDK and we'll do our job to try and get as many answers as we can for you.
Yeah, we have
Yeah.
three CLTs on our board with very different backgrounds.
Very different
So
backgrounds, but
if
we
you
all
just
like each
email,
other and we all
yeah.
work together and it works great.
Yeah, it's amazing. So if you just email our info email, Jeannie's very responsive and she will escalate to Robin, Jennifer, and PDK, as Robin just said, as needed. Robin, obviously, you're the like Bible here, but
I'm
we
the
might get
geek.
some insight from other
There's a
folks if
difference.
needed.
I'm a geek. And so the great part is Jennifer is
Sorry,
with
that's what I meant.
yeah, so Jennifer is like she's always worked sort of in more of the public health system. And so if there's issues in regards to like accessing, treatment, et cetera, through the general public system, Jennifer's got the answers. And PDK is a phenomenal mobile certified lymphedema therapist up in Edmonton. And so he sees very different things than what I do.
Hmm.
So we
Hmm.
work together amazingly well because we all have our little things, right? So yeah.
Yeah. And then Diane made the comment, I think the question that Fran asked is very important because the person that did not even finish the 135 hours is not the person you want to have work on you. Any comments on this?
But I will go back to Fran's question though, because Fran's question ended. She goes, would they be considered lymphatic therapists, not lymphedema therapists? So, Fran, if you see somebody and they've done like a couple courses, but they haven't gone the whole 135 with because the other thing with the 135 is there's an exam process. Like if you go through my program, you take level one, two, three, you do the 7-day lymphedema course, and then there's a written exam, and then I test you hands-on wise and watch you wrap a limb and test it and all those things. If they haven't gone through that, and every school for lymphedema does the on-site testing. Actually, I'm going to put it back up here for a second so you guys can see this because I did mean it before. I'll show you something really cool. Where is it? No, 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 no. Go back. Ah. If I take you back to this, look at this down here. So the program director or program instructor must occur in the same physical space. There has to be an in-person assessment and a remote assessment will not be accepted. So if somebody says, well, I didn't really do the exam, whatever, they have to have completed an exam hands-on, like this is written and hands-on tested. Like I have to watch them do the hands-on techniques. I have to watch them do taping. I have to make them wrap a limb based on a case study that they got. They have to show me the home care. They have to show me the skin care. They have to show me the exercises. So it's not just a simple, I took this course and I got a certificate. If they took the course and they just got given a certificate, they're probably a lymphatic therapist, which they still have training. They still know, they still have a greater knowledge than a regular massage therapist. Not trying to put down a regular massage therapist because I was one and they're great. So, yeah. When CLTs do their training and get their certificate, do they do the techniques on a patient? Oh, that's a hard question. So, honestly, Diana, they don't. And there's a reason. So when we're doing class, we do bring in lymphedema patients, and I do always try and bring in a lipedema patient so people they can feel the difference and notice the difference within the tissues. But because it's a test, and because by them doing techniques, that would be considered treatment, but they're not technically certified yet, if something went wrong, the legal ramifications. So, what it is that they are given a scenario that sort of walks them through, like, this is the condition, this is what they look like, how would you treat them? And then they actually treat a classmate in the exam. That's the only way we can safely get around it because like for example, I'm doing the certification course. I'm teaching it in May here in Calgary. And some of my students are from out of province. Like I have students who are coming from Ontario who are coming from the US. And so they don't have the legal safety to treat here either. So I know what you're talking about, and I wish it could happen, but until we become less litigious as a society, 'tis the rules, my friend. But I do bring in patients for the therapist to see the tissue, feel the lymphatic movement, feel fibrosity, all those things. Yeah.
Yeah, and I mean, we also have quite a good network as an association. So if you have a specific requirement, like you want a therapist that has worked with specific conditions, you can reach out to us and we can recommend you with someone,
Mhm.
and connect you with them as well.
Yeah. And Joette just made like a really great point is like I said, I've been a massage therapist for 25 years. I've been a lymph therapist for 20, which means for the 10 years between me being a lymphatic therapist and then a lymphedema therapist, I worked on every kind of swelling that was not lymphedema. So I worked with sinus issues. I had patients who went to the dentist and had massive swellings because of like dental surgery. I worked on eyeball swellings from like, lens surgeries. I've worked, with crazy lymph conditions, lots of swelling conditions out there that were not lymphedema. And so there is a lot of work, and there are a lot of people that are looking for lymphatic therapists. But, obviously, lymphedema is because it has lymph in its name, everybody assumes that if you have lymphedema, you just see a lymph therapist. It is not the same, unfortunately.
Yeah.
So I
We're
totally
not
agree,
trying to
Joette.
bag on those people. Like they
No, my God,
are
no, because they're
amazing.
so
Like so many
necessary.
people, so many patients have like relied on their
I know.
lymphatic therapists, their RMTs for things for so many years. This is
Yeah,
just an extra amount of specialization that you do need on
yeah.
top of that or instead of that, depending on your situation.
Yeah. And most therapists, like, we are genuinely bleeding hearts. Like, we love helping people. That's why we got into it in the first place. So it was really hard when I was a lymphatic therapist turning down lymphedema patients because some of them had been waiting for a long time, couldn't get into the companies, they couldn't get into all those other things. And they just needed somebody,
Yeah.
right? But there is a lot of things, unfortunately, that you can do as a lymph therapist that will not be beneficial and will not help a lymphedema therapist. So, or a lymphedema patient, sorry. So, yeah. Fran, here in Newfoundland, in most areas outside of St. John's, any leg wrapping would be done by community nurses. Oh my gosh. In this case, would it be reasonable? My support from. Okay, so you can get wrapping done by nurses. Hopefully, they have the training to understand the difference between traditional wrapping and lymphedema wrapping, because there is a difference in the material, but also the application. Um, it just depends. If you have a lymphatic therapist, if that's all you have access to, it's better than nothing. Like, honestly, if there's no lymphedema therapist and you're sitting there and this is all you have, I would love for that lymphatic therapist to call me or another lymphedema therapist and get some support until you can find a lymphedema therapist local. I am working very hard with the Newfoundland Labrador Lymphedema Association to try and bring some courses out to Newfoundland because this is something that we tried to do in 2020 and then something happened and we couldn't go out. And I was like, that's lame excuse. Um, yeah. So we are trying to bring more courses out to the west, or sorry, to the East Coast.
Yeah, and
Um,
I'm pretty sure Fran is part of that association. So I
yeah,
think that's why
I'm
she's
working.
asking. Yeah.
Melanie and I are working on it together.
Oh,
So,
okay, okay. Yeah, and I
I,
mean, we have the same problem in Alberta in the
I know.
rural areas. We have like home care nurses doing a lot of the wrapping for our patients as well. Like, it's not perfect out here by any
Hmm.
means. And then to see the CLTs in most cases that Robin is mentioning, it does cost like financial resources directly from the patient. So
Yeah,
obviously these are ongoing issues
yeah.
that all of us have as well. But yeah, it's good to know like where they can accept that partial treatment and
It's
where they
better
should
than
seek more.
nothing.
Yeah,
And
totally.
honestly, if I had my way, I would just fly out there and do what I could. Because honestly, it's just there's enough. there's just so many opportunities for lymphedema to sort of not smack you back, but I mean, you got to know what you're doing, otherwise you can make things worse. Diana asked if there's courses for patients to learn the wrapping or self-MLD. Normally, you learn that from your therapist, and the reason is because how your body reroutes lymph is not the same as anybody else's. So each person is so absolutely freaking unique in how their lymph moves that how I would direct you to do your bandaging and you to do your self MLD and your own self is going to be different than Diane, right? Versus Allison versus anybody else. So ideally, you should learn that from your therapist because it'll be specifically designed for your acute body instead of somebody else's. The hard part with lymphatics is that you really can't treat it like everyone's the same in the textbook. It's so freaking unique and it's annoying that way. Trust
Like
me.
a constant reminder that I'm giving people, like just
Yeah.
like make sure, like yes, these recommendations are great, but make sure you consult with someone who's actually seen you and your particular
Yeah.
circumstance, right?
It's actually why
Um,
I have no videos on YouTube that show you how to do lymphatic drainage for yourself unless you have a happy, healthy system. Like you will never
yeah.
see me do a video going, if you have lymphedema in your arm, this is how you do it. Because
And
it can't.
I know I've been talking to
Guys,
Jennifer from CALS, the Calgary Ambulatory Lymphedema Service, as well as people from CRIS, which is the equivalent in Edmonton,
okay.
about doing something like that. So we may have like a general video with some examples with real patients
Yeah.
at some
But
point
it'll
this
have
year.
all the caveats at the
All the
beginning. Be like,
caveats.
this does not
Yeah,
replace a therapist.
all the
This does not.
caveats.
It's really hard because if I watch some of those videos and I love that Carolyn put this in, but she was like, social media makes me shake. Most of the time, if something shows up lymphatics and it's showing you how to do like, lymph techniques and they're doing this. And I'm like, what the hell is that?
Right. Yeah, there's so much misinformation about every
Yeah.
aspect of the world right now that you really need to know who to rely on. So if you need any confirmation, like I said, the association, whenever anyone reaches out to us, and Diana knows this as well, with any like type of treatment modality or new research that's come out, we always reach out to our research experts, like the top researchers in the country on lymphedema, as well as like the medical experts in the field. And we ask them for like their assessment of the research. And we ask them, what is the current consensus on this? And they give that to us. And then we pass that back. So please do not hesitate to reach out to the email that I've put in the chat several times.
Yeah. Ina, I love your question. So basically, to be a lymphedema therapist, you just have to have a license to touch. So, for example, if you were like an accountant, you could take the course, but you could only treat yourself because you can't touch somebody else and have safety from like medical malpractice and all that kind of stuff, right? So if you are a nurse, if you're a PT, I've had reflexologists, acupuncturists, all have a license to touch. As a nurse, that's your job. So you would actually go through the same kinds of training as an RMT would. And so, for example, Jennifer McNish, she is the head of CALS. She is a lymphedema therapist and she's a PT first. So as long as you have a license to touch, you are absolutely gung-ho able to take a lymphedema training. Okay. And Tammy rule means outside Calgary and Edmonton. Yep. Yeah, if you're in Leduc, heck yeah, man. If you're in I on Monday I was at the Alberta massage conferences and I met people in like Lloydminster, somebody who was in Banff, somebody who was from Lethbridge, from Pincher Creek, anything outside of Calgary, Edmonton, Red Deer even, like we'll still, yeah, yeah, anything other than the big centers. We still need more therapists in the big centers, but there's definitely the need for, the smaller communities so that way people aren't, with lymphedema, it's not advisable to sit in a car for 4 hours to get to your therapist. It's actually counterproductive. And so to drive from Jasper to see me and then have to drive back to Jasper, honestly, it's not good for you and it'll make things worse. So, um, yeah, Diana, I know what you mean. And I love how you put unofficially because that was your legal safety word right there. Um, but yes, a lot of times the ultrasounds and it's it's the unfortunate piece is it is very hard to get officially diagnosed and to get doctors who fully understand what lymphedema or lipedema is. And so that's one of the main reasons why wanted to be the VP and be on the board for the Alberta Lymphedema Association because that's ridiculous and it should be better. And I think that's where the advocacy part comes in. And so anybody who chooses to volunteer, join the board, work on programs to try and help change things, that is one of the major reasons why is your story, like you saying that, is so freaking normal that it drives me crazy. The amount of times people said that and always said that coming in, they're like, well, I don't know, it took me 4 years to be diagnosed, and even the doctor who did didn't really fully believe it. And, so what are we going to totally do? And it's exhausting. So,
Just to
yeah,
add to that, that was after they did a biopsy to my lymphedema spot.
yeah,
So,
I
which is
know.
the absolute worst thing they could do.
Yeah.
So, yeah,
And that's weird because biopsies of a lymphedema tissue is not normal. So, yeah, yeah. So I totally am on board with you there. So, and yeah, like, if you want to reach out, I can help connect you. But honestly, you don't need an RMT. You just need to have a license to touch. And if you go on there, it says LPNs, it says RNs, RMTs, PTs, OTs. Honestly, acupuncturist. I know a vet who's a CLT because she works on lymphedema for animals, which is more common than you think. So, so many good things. And obviously, if you learn anything or there's anything that's different that shows up in in your province or your area of the country, please let us know, and we'd love to make sure that information gets shared out with everybody else too. So, yeah. I'm so glad you guys had time on a cool like Wednesday, March 18th to come and hang out, and thank you so much for asking amazing questions, and yeah, I appreciate it.
Yeah, great engagement. Happy late birthday, Robin. It was Robin's birthday on Monday.
Thank you.
And happy World Lymphedema Month to everyone. Thank you so much for attending and learning today and being engaged and asking questions for sure. Reach out to us, please, with absolutely any question, no matter how stupid you might think it is
It's
not.
normally not stupid. That's the problem.
Yeah, so please do that, and we will connect you with Robin if needed. So just do that. And thank you so much, Robin. This was
My pleasure.
extremely helpful.
Yeah, no, wonderful. And it was really fun to actually put it together and really like clarify all the different pieces. So it was good. It was a good process for me too. So, yeah, my absolute pleasure. So thanks you so much to everybody for attending and yeah, great stuff.
Good night.